agenda is Holly Leahy, and I see she has arrived, electronically speaking. And if you'd like to introduce yourself, Holly, and your position, then you may proceed.
Good morning. My name is Holly Leahy, Administrator for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Programs. Since the 1980s, Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Programs has had a licensed provider of mental health targeted case management services embedded within our county department. It has been a privilege to serve our community over the years with these services. However, the beginning of March 2021, a decision was made to privatize mental health targeted case management services beginning July 1, 2021, due to serious financial difficulties. A request for proposals was created and distributed electronically to solicit proposals for targeted case management services from the current targeted case management providers in this region. We are pleased to present to you today the targeted case management proposal received from Service Access and Management, referred to as SAM. SAM has been providing services since 1987 to individuals and families, serving children, youth, young adults, and older adults through expansive service lines throughout the state of Pennsylvania. They have also been a provider of intellectual disabilities supports coordination in Lebanon County since 2016. We believe SAM would bring expansive knowledge, experience, and quality targeted case management services to the mental health service line in Lebanon County. You have received a copy of the full proposal submitted by SAM, and I'm here this morning seeking your approval to accept SAM as the new provider of targeted case management services for Lebanon County.
Motion?
I'll make a motion.
Go ahead. I'm sorry, Commissioner.
No, that's all right.
Go ahead.
Are you sure?
Yes.
Well, okay. I do make a motion to approve SAM as our contractor for mental health services.
Okay. I'll second the motion.
All right, there's a motion and a second, and my comment regarding the packet is that I appreciate the letters of support from other counties to recognize the quality of their care, and then also from the healthcare providers that you included in the packet. So that gives us a reference of other users of the this vendor. So thank you for including those. Any other comments or questions regarding the motion, Commissioner Litz?
Yes, I'd like to just state that we all value the clients, their families, and our employees. This decision is not being made lightly. A lot of research, and Holly and her management staff worked hard on this for us. And I ask a lot of questions personally because I don't like pushing things through if all my questions are not answered. And indeed, they answered every one, and I couldn't find fault with the rationale to right the ship. And SAM is a familiar company. They've been doing work for the county, and also they actually bid on Cedar Haven. I don't know who all remembers that, but they have been around a while. They're just up north of us, one county in Schuylkill, so they're not far away. They're close to home. They have excellent recommendations, as Commissioner Phillips said, among those from Philhaven Hospital and others, as he mentioned. And we're one of a few counties left in the state using the old direct case management system when we're supposed to be managing others who go into the field. And it's my understanding that the state prefers this newer model. So we are coming into, it wasn't a mandate, understand, but coming into the newer way of thinking in order to make everything work. And I just can't thank everyone enough for all your cooperation, your patience, your understanding in this most difficult time for everyone. We ask you to keep our staff and the clients and their families and everyone at the county in your prayers. Thank you.
Okay. In addition to that, Jamie.
I just have two quick add-ons, but they can be right at the end. Go ahead, commissioners first.
My only add-on is that I want to thank Holly, myself, and on behalf of, I'm sure I make an assumption, but on behalf of everyone involved in this, that you've been very deep in it and diligent about getting the best alternative that we could find, that to carry on the quality of service that you've had since the late 80s. So I do appreciate, this has been a tough road to get through with your challenges, and you've done it so well. And thank you for representing the county so well. Jamie?
Thank you.
Yeah, I just want to mention that the Holly did go over this with her advisory board. As you know, there's a MHIDEI advisory board, which is established by state statute from the 1960s, is required to be there. And we've always worked hand in hand with that advisory board. And so they've had an opportunity to go through this and ask questions and so on. And I believe we're unanimously satisfied with the process and with the outcome and so on. Excuse me. And also, I just want to mention, this is a very, very trying time for a lot of the staff and the management there. If you noticed in the transactions for personnel this morning, a number of MHID staff are transitioning over to children and youth. Children and youth's workload has increased dramatically, and there are openings there and new positions there. So fortunately, there was a place for some of these individuals who have been doing this case management for a long time to be able to transition over to children and youth. That, however, means that between now and July 1st, this still needs to be maintained. And so, sorry, I got a tickle. So management is going to have to step in and be making some of the telephone calls and monitoring of these cases. So it's going to be tough. It has just been tough on everybody. So.
And I can back Jamie and Holly up on those comments. The staff, I haven't been able to talk to them directly, but I am on the MHIDEI advisory board, and everyone there was so professional. And again, they asked tons of questions, were very thoughtful, read the entire contract cover to cover. I mean, the questions they asked were very in-depth, and everyone was answered, and it was a mutual consensus to support the transaction.
Okay, Jamie, did you have something else? No? All in favor of the motion as presented for this provider contract? In favor, please indicate by saying aye.
Aye.
Opposed, same sign. So moved. All right, Holly, carry on.
I have one more thing, if I could, kind of going hand in hand with accepting Sam as the new targeted case management provider for Lebanon County. Sam has submitted a startup budget of $98,668 for the time period of May and June 2021. This budget will fund for office supplies, technology, and staffing necessary to begin services in our Lebanon County community on July 1, 2021. We will be able to use county block grant funds for the startup costs, so we are not asking for any county tax dollars for this contract, but I am seeking your approval to create a provider contract with Sam in the amount of $98,668 for the remainder of this fiscal year 2020-2021.
I'll make a motion to accept the startup contract as presented.
And I'll second the motion.
Okay, we have a motion and a second to approve that bridge contract to the end of the fiscal year. Any comment or question? Hearing none, all in favor, please indicate by saying aye.
Aye.
Opposed, same sign. So moved.
I just want to express my appreciation to all of you for your support as we have gone through this. And as Jamie mentioned, we'll continue to be going through a transitional time period over the next few months. And I just would like to thank you again for your support.
You're welcome. Hi.
Thank you.
Thank you for your leadership.
Thank you. All right, Holly.